another 1,000 years. It's left my mind in all my tears.
So, welcome everyone. My name is Jesus Guzman. I'm the Policy and Advocacy Director here for Generation Housing. Before we start the program, just want to offer a few housekeeping items. First, we have, oh, excuse me, sorry about that. We have, do want to share this event is being simultaneously translated into Spanish. Este evento está siendo transmitido en vivo en español. So to access that feature, click on the interpretation button at the bottom of your screen and select Spanish. Para acceder a este servicio, favor de oprimir el botón al fondo de su pantalla y seleccionar el botón para español. And we want to thank Gabriel Gutierrez, who is with us tonight, offering our audience live Spanish interpretation this evening. Next, just a quick note about participation for the webinar. We do invite the audience to submit questions using the Q&A function also at the bottom of your screen, and we encourage you to submit a question and upvote the ones you'd most like answered, which we'll get to after the moderated discussion remarks. Okay, so Generation Housing, just want to share a few words about tonight's event and about our organization. Generation Housing is in its first year of advocating for more housing, more diverse and more affordable housing. And we do this work because we know that safe, stable, affordable housing is the prescription for healthy people and at the center of healthy communities. Unfortunately, health, education, and wealth outcomes, even life expectancy, can be predicted by zip code. The kind of home you live in, where it sits matters, and whether you own it matters. And that's part of the reason why we wanted to host this conversation on health and housing tonight, because there is overwhelming evidence connecting housing and health. And I want to help set a frame about the way in which we think about these two issues. When we look at the evidence, we see that 4 characteristics weigh heavily on this connection. The first, affordability. Second, quality and safety. Third, housing stability. And lastly, neighborhood. So in tonight's discussion, you'll hear from a panel of local and national experts about how these 4 factors connect and the many strategies being employed to advance housing solutions for healthier communities. Most of our panelists this evening have a health background. We wanted to emphasize and create a space to hear from those working in healthcare about the ways in which they view housing intersecting with their work, along with ideas on potential partnerships and policies that we should be thinking about advancing. So with that, I want to turn to introducing our panel for the evening. So let's see here. There we go. So first, we have Oscar Chavez. Oscar Chavez is the Assistant Director of the Sonoma County Human Services Department. He oversees the county's Upstream Investments Initiative, which we'll hear a little bit more about in a moment. It's the department's planning, research, and evaluation functions, and community and client engagement. Oscar serves as the board president of Latino Service Providers, chair of Sonoma County Community Development Committee, chair of First 5 Sonoma County, leadership council member of California Forward, co-chair of California Stewardship Network, and a steering committee member of Rise Together, a 9-county Bay Area initiative committed to ending poverty. Oscar, thank you for being with us tonight. Next, I want to introduce Chris Stewart. Chris Stewart is the medical director for Santa Rosa Community Health. He's a local to the Bay Area, lives in Petaluma with his wife and 2 kids, practices at Santa Rosa Community Health, and has been there since January of 1999 at the initial Lombardi Court site, serving primary care needs of underserved individuals and families of the Roseland community. In 2017, Chris transitioned into the medical director role at Brookwood campus. In the Brookwood campus and outreach sites team serves our homeless and special populations of Sonoma County. Chris, thank you for being with us tonight. Next,
Thanks
I
for
want
having me.
I want to introduce Alegría. Alegría is the director for the Sonoma County. She's the director of the Sonoma County Office of Equity. The Board of Supervisors appointed Alegría as the director of the newly established Office of Equity, and she previously served in the County Council's office for 5 years. Before joining the County of Sonoma, Alegría worked in public service and public interest for the state of California, the Center on Race, Poverty, and the Environment, and at the California Rural Legal Assistance. Alegría identifies as a Chicana and recognizes, embraces, and celebrates her responsibility to contribute meaningfully to public service, social justice, and equity. Alegría, thank you for being with us tonight. And then next, I'm really excited to welcome Dennis Pocekay. Dennis is the City Council Person-elect for Petaluma and also winner of the coolest photo. I really love this photo. So Dennis, thank you for sharing this with us. Dennis is a retired Kaiser physician who specializes in internal medicine, geriatrics, and occupational and environmental medicine. After retirement, he taught undergrad intro to public health at UC Davis for 7 years. And during these years, he became convinced that every public policy has significant effects on the health of the community, and recently won a seat on the Petaluma City Council. And big congratulations to Dennis. And again, thank you for joining us this evening. And lastly, but certainly not least, really also honored and excited to welcome Melissa Chinchilla. Dr. Chinchilla is a research scientist at Ultimate Institute for Health and Health Equity based out of Southern California. Her research focuses on the social determinants of health, including housing and homelessness, and increasing community and patient participation in the research process. And Dr. Chinchilla holds a doctorate from the Department of Urban Studies and Planning at MIT, and a Master's of Health Policy Management from UCLA's Fielding School of Public Health. So that is one, very excited to have everyone with us tonight. And Dr. Jason Cunningham, who, as I was sharing screens, thank you for joining us.
Never.
Really glad that you're here, and want to offer a brief also introduction of Dr. Cunningham, who is the CEO of West County Health Centers, a federally qualified health center caring for patients in Western Sonoma County, and I believe a Michigan Wolverine as well, if I'm not mistaken.
Go Blue.
Jason, thank you for being with us, and thank you to everybody here with us as well. I want to jump into the conversation here around housing and health, and want to start with Oscar. We were just mentioning in the intro about your bio regarding upstream investments, and I think when we think about solving big issues, it's really important to identify the root causes, right, that drive these issues, and housing is at the root of a lot of these problems that emanate, that are downstream of housing. So I want to ask you, Oscar, about your department and upstream investments initiative, and curious about how you think about housing as an upstream investment.
Great, thank you so much, Jesus, and thank you for raising this important issue of the connection between housing and health. This is not a new issue. We've always known that there's been a connection between housing and health, and COVID just peeled the veneer or the layer of how deadly it can be when we don't focus on adequate housing. And you're right, when you think about upstream investments, there is no better superior strategy than investing upstream, because we mitigate a lot of the costly issues and problems that we're dealing with today. And that was really the genesis or the origins of why the county had the foresight to invest and to create this program called Upstream. It recognized and stated that, rather than building a new jail, what if we were to create and invest in programs that created a different pathway or created more opportunities away from the criminal justice system and into opportunities where young people had access to opportunity. And, this is not rocket science when we're talking about investing upstream. We're talking about, creating the conditions in communities for people to be successful and to thrive. It is really about supporting those individuals furthest away from opportunity and creating the fertile ground for families and individuals to have success. And we're talking about things like affordable housing. We are talking about things like quality schools. We're talking about access to healthcare. We're talking about access to open space, to safety in their communities. We can't separate the issue of housing from these other very important issues because they're all part of the ecosystem. And I think that's been part of the problem, is that we've tried to address these issues in isolation, recognizing that they're all interrelated. And so when I think about, what makes a good community that provides opportunity for all, it is a community that has affordable housing, that has a pathway for home ownership, that allows families not to spend more than 50% of their income on housing, that provides for some discretionary income to actually provide a good quality of life for their children. When they have that, they have reduced stress. They don't have to worry about where they're going to get the next paycheck to pay for their housing. When you don't have that stress, you're not as sick as much, and when you're not as sick as much, you have more time that you can spend on your job. So this is all interrelated. And so the whole goal of Upstream is to shift our thinking away from this crisis mindset that so many of our systems operate in today, where it's all about putting out the fire, and recognizing that by shifting our orientation towards systems that prevent and mitigate a lot of these problems, we can actually save a whole hell of a lot of money in the long run, and improve the quality of life and reduce the immense amount of suffering that currently is plaguing so many of our community members.
Oscar, thank you for that. I'd like to open it up and see if how others have seen this approach sort of show up in your work as you you think about the way that housing is an upstream approach as well in your work. So curious about how others are thinking about this as well. Yeah, Dennis.
Yeah, I just at Brookwood, we often see folks getting out of jail, and there's this cycle of they get out, they're sent to the street, and we're lucky if we get them right away to try to help them get their health and try to get them resources, but sometimes we don't, and the cycle just keeps going. So that's the example that I see so often, and it's really frustrating, because that if you could get these folks into stable housing, that would it always gives people the opportunity to begin to look at other aspects of their life. It's hard to get sober. It's hard to get anything good in your life if you don't have a roof over your head when you're really living at that bottom rung of Maslow's scale. How do you really look up at anything? And so, the folks that we have been able to find housing for, and I've been really impressed with the county's work through COVID. They were already working on things. They had Los Gilicos. They had Caritas has been in the works with Catholic Charities, and then Sam Jones is expanding. Those kind of things have been going on. But I've seen a lot of my chronically homeless folks getting longer term housing in the last several months, and on the heels of all of this work around COVID, and it's changing their lives. I see these people coming in looking different and looking happy, and beginning to put the pieces together of their lives. So, yeah.
And Dennis, it looks like you wanted to add, and maybe we'll come to Alegría right after Dennis.
Sure. I just wanted to underline Oscar's point about stress. We talk a lot about lead poisoning and asthma and other conditions that are important, but affect a few people in different communities, whereas the toxic stress of chronic insecurity about a roof over your head, I believe affects a majority of folks in that position. And this is not just stress. I mean, it's been shown to take years off lives. when it's chronic. And so I just wanted to reemphasize that point.
Okay, thank you, Dennis and Alegría.
Yeah, I thank you for this conversation, Jesus and Jen H. And it's really nice to be in conversation with such an awesome group of people. I think it's really important for us to really use kind of a race equity lens on this conversation and recognize that everything that we're talking about here, the single biggest indicator about how well somebody's housed, how healthy somebody is, what levels of education they have, what kinds of access to the kind of quality of education that they have, is still the single biggest indicator in our country and in our county is still race. And so I think it's really critical for us to recognize the ways in which a holistic kind of perspective on people, right, that includes a recognition that housing has everything to do with health, is also really, it requires us to recognize that the focus needs to be on communities of color, and to really address kind of deeply entrenched and generational disinvestment in these communities that results in these kinds of outcomes. You know, and I think especially as we think about, you know, the county of Sonoma and what it means for us to have gone through now years and years of different disasters, and recognizing that the impacts of those disasters on poor communities of color and specifically on folks who find it difficult to access resources, you know, without disasters, we're actually also walking right into systems that are actually designed to exclude people who most need them. So I'm thinking about folks who are undocumented, folks who are not kind of English speaking as a primary language, right? So we have such a responsibility in this county in particular to really have an eye and a focus on and some caring attention, and you know, and a gaze that is about understanding kind of the root causes of those outcomes, and not a gaze that's about kind of othering or creating a situation where we're seeing, you know, people as, oh, these poor folks, and you know, they just can't seem to get it together. It's like really understanding people's positionality in a holistic way, and really kind of grounding that in the history of systems in our country that have been designed using race, and how that has impacted people's outcomes today. So I just want to remind us that we have this conversation that's really critical to be really clearly centering race and how important it is for us to really see that. And as we continue this conversation, to make sure that we're centering communities of color in this conversation.
Yeah, thank you for grounding us in that. And I want to turn to Melissa.
Yeah, thank you, Jesus. So this conversation just makes me think that it's a good opportunity for me to share some of the work that Ultimate is doing as a large federally qualified healthcare center when it comes to social determinants of health and addressing upstream factors. You know, in recent years, we've seen a lot of movement in the healthcare field, in part because of the Affordable Care Act, to take into consideration the role that social determinants of health play in people's health. And so we see that, you know, traditional healthcare providers are beginning to think more about, well, what is causing some of the issues that their patients are seeing? Where are they sending their patients back after they've maybe put a, you know, Band-Aid solution on a health issue, and patients are going back to the same, maybe unstable housing situation or substandard housing situation that's exacerbating their health problems. So in general, we've seen the healthcare field begin to pay greater attention to social determinants of health. And, you know, one of the things that I wanted to share with regards to Altamed's work is that in addition to, you know, providing clinical services to low-income populations, predominantly within the Latino community, another thing that Altamed's really doing, which I think is really innovative, and they're spearheading in a lot of ways, is that they're also engaging the communities that they work with and the patients that they work with in civic action. And so, you know, most recently, Altamed was really at the forefront of getting people in our communities to fill out the census, which we all know means additional resources for local communities. So they were leading on the ground outreach, within clinic outreach, to get folks to fill out the census. There's also been some work from Altamed on voter engagement. So, you know, registering folks to vote, low propensity voters, getting our communities to get active. So Altamed has been doing a lot of work around civic engagement, recognizing that what we're seeing is really issues with the system, systemic issues. And as Alegría was pointing out, issues that predominantly affect communities of color.
Great, thank you, Melissa. And lastly, we'll turn to Jason.
Yeah, I guess I'd just like to highlight a few and just kind of reinforce some of what's been said. It's just honestly a joy to see engaged, powerful, dynamic leadership here in this panel, but really led kind of in this discussion. I think we in healthcare are so often siloed. It's primary care, it's Kaiser, it's the community health centers, it's St. Joseph, it's the county. We tend to get paid differently. We have different incentives. It's difficult, and we're all overworked and feel like we have, minimal funding. Homelessness is just like systemic racism, just like all some of these other wicked problems. It requires a collective action. There's no way that we can solve it by one simple. It's not a problem of just education. It's not a problem of just housing lack of capacity. It's not a problem of just mental illness and lack of it. It's not a problem just of addiction, or however we kind of focus on what it is. It's all of those things. And in order for us to make a movement towards it, it requires us to figure out how to have these conversations, to actually do the ear-to-ear stuff, work together on something. And as Dennis was saying, the impacts, there's been study after study that chronic homelessness reduces the life expectancy by 20 to 30 years. So when somebody comes into our office and they're a 40-year-old and they've got chest pain, I don't normally think of heart disease. I think of GERD or acid reflux. If you've had chronic homelessness, we should be thinking about advanced heart disease and other things. But if you broaden that to say we think of the chronic homelessness, we also think of housing insecurity, which brings up long-term generational trauma. So for us to take on, I really like what Oscar was getting at, the upstream approach isn't just about fixing the chronic homelessness on the street. It's also about decreasing the transmission of trauma through generations. And so if we can take that upstream approach to say, what is it to really make somebody have the skill set and the support to be successful when they get into housing? What are we looking at for some of these other social determinants on a broader view will be more successful? So super excited that we've got a dynamic we're finally coming together, really kind of doing this work together. Chris, I was going to say hi. We've spent many years working together. It's been a while since we've talked. So.
Jason, thank you for that. And I want to pick up on a thread that from Alegría around racial equity. Last week we had a conversation with Richard Rothstein, who's spoke with us about the color of law, and it's a book about the U.S.'s role in really the sort of the driver around housing segregation in the United States, and how it intentionally segregated communities in the United States through housing policies. And so as we sort of fast forward now, one of the ways that housing segregation has manifested itself into poor health outcomes, for example, can be seen, and I'll give you an example here locally in terms of life expectancy by zip code. I pulled some of these numbers up for Sonoma County. The CDC has a really excellent website on this. And when you look at Bennett Valley, it has a life expectancy of 85. It's also one of the whitest counties in Sonoma County, one of the whitest, census tracts or neighborhoods in Sonoma County. On the other hand, when you look at one of the census tracts in the heart of Roseland, one of the most diverse neighborhoods in the county, you find that folks there live on average of 77 years. We're talking about a difference of 8 years of life, and we're talking about 10-minute drive between the two neighborhoods. Neighborhoods obviously plays a critical and pivotal role. Where you live has a role on your life expectancy, your health. You just mentioned as well about chronic homelessness and the effect that has on life expectancy. So I'm curious about this aspect of neighborhoods and the way that has an effect on health. And I think a second piece to that question that I want to pose to everyone here is when experts talk about sort of high resource opportunity areas, what do they mean exactly? What access to resources within these neighborhoods exist that are affecting health as well? So I'll open it up, and it looks like Alegría.
Jesus, I think that's such a great frame to really talk about. And there was two things that I wanted to kind of pick up on. So when you talk about Roseland, you talk about it being diverse. And I actually think that what's actually important about recognizing is that Roseland is a community of color, right? It's not necessarily diverse, that it's still segregated in terms of the way that we understand Bennett Valley as being a segregated community. And so I think it's really important to name those things so that we can be really clear about what it is that we, the words that we're using when we have this conversation. The second thing that I just wanted us to think about, the Department of Health at Sonoma County with an equity lens has really come into this question about, how do we start to flatten some of this really racialized spike in COVID cases, recognizing some of the deep intertwined, interconnected challenges in the Latinx and Indigenous language speaking communities. And I think it's really critical for us to come into this conversation thinking about, how do we recognize assets in those communities that also are struggling with inequities? And how do we come into this conversation recognizing and being able to name and celebrate those deep assets and recognize those assets as part of, what we have to work with instead of just a deficit mindset. So, there's such power in the ways in which, powerful women in the Rosen community have long spread the word and spread news about, what's happening and how to share information, throughout those communities, word of mouth. There's such trusted voices in those communities. How do we understand some of those things really as being, an asset mindset as we come into what we think about, high resource communities? And so I would challenge all of us to really come into the conversation, recognizing those as assets, and then saying, what do we need to layer on top of those assets to make sure that those assets have, the wings on them that will allow those communities to really soar into equity, into being, a kind of community that people will also experience the kinds of outcomes in health and wealth and well-being as a result of our being able to recognize those things that they also celebrate and really uphold as assets in their community.
Jesus, I wanted to add on to that. I mean, it's, we've done a really good job here in Sonoma County to divide our community along race and class. That is not by accident. When you look at the kinds of structural and policies that we've implemented over the last decades, this is by design. And I know that's a very controversial thing to say, but I think it is the kinds of policies that we have advanced over the past couple of decades that have created a situation where we have two communities, and you brought up the Bennett Valley and the Roseland. The question that I think needs to be asked is, what is it about those two communities that are within 5 miles of each other that are resulted in very different life experiences for the people living there? It is ironic that we share the same roads, but we live in completely different worlds. A 10-year difference in life expectancy, that is just simply unacceptable. And so I think we have to really move away, as Alegría say, the people of Roseland have tremendous amount of resiliency. They've dealt with a lot of adversity. You have to be smart to be able to deal with the kind of stress and trauma that a lot of our low-income communities deal with. You just have to survive. And so I think we need to look at the kinds of policies that have resulted in that kind of disproportionality if we are to begin to create greater opportunity and close these opportunity gaps that keep people away from the kinds of opportunities that we're talking about. I mean, high performing schools, neighborhoods with good paying jobs, housing that's affordable, parks that are accessible, sidewalks, grocery stores that are available to provide healthy food. Again, it is a constellation of what makes a good neighborhood that we ought to be focusing on. When you create the conditions for people to thrive, they will rise to that opportunity. But if you deprive them through very intentional, strategies, then that's where you begin to see the kind of trauma that impacts communities, and that's where you begin to see the disproportionality in quality of life over time.
Thank you, Oscar. I think Jason also wanted to add to that.
Yeah, it strikes me that we're having an interesting conversation about kind of two ends of the spectrum, where we've got some real leadership on this, the environment that we are living in, and making sure that we're investing upstream and preventatively looking at how do we raise the water for all of us so that we are naturally able to thrive, and looking at an asset-based solution for that. And I think we miss out on that because we look at like Oscar was saying in the beginning, we look at this kind of downstream effects of where we're putting out fire from these things. And so I think that's where we need to put more energy into the leadership and the investment, there's a lot more return on investment in that way. And on the other end of the spectrum is how do we deal with those who have had systemic trauma and who have had a life lived in homelessness or an incredible amount of stress, which really deals with this kind of Gary, I really appreciate that link that you were talking about, that interdisciplinary or interdepartmental multidisciplinary team, the IMDT that they're talking about, requires us to look at solutions for individuals that cross neighborhoods, that cross systems. And most of the systems that do well also invest where you have hyper-local, high-touch investment in the community. So you're really bringing out the assets in your promotorists and your community health workers that are, we're not saying, here's something you need to follow my directions. It's really partnering and figuring out the psychosocial issues that are coming at it. So it strikes me that we're talking about a number of different sides of the same problem here that really requires a complex decision and complex discussion. So I really thanks for this kind of opportunity to kind of open these bigger debates, thoughts.
Dennis?
Yeah, this is maybe a little bit off the thread, but I wanted to get it in somewhere. In terms of you know, the redlining history and this kind of stuff, and the fact that people who are suffering poor housing also, you know, are suffering in other areas, education, economic status, and also in accumulation of wealth, you know, getting a portion of the wealth that this country has a great deal of. And I don't hear as much talk in housing circles as I'd like to about community housing land trusts. You know, it seems to me that these should be getting more thought than they have been. I'm wondering if anyone, I really looking for thoughts in that regard in terms of my new position. Anybody have?
Well,
Yeah, Dennis, I think that's a wonderful kind of model that is grounded in a recognition of community assets and resilience, right? And the ability to do things when you come together. For folks who have less, when you come together, you have more. And so this philosophy of or this model of a community land trust, I think, is really something exciting for us to consider that builds on that, on that philosophy that we have assets in these communities. I was sharing with Jesus earlier, in preparation for tonight, that my housing situation is a very, very mini version of a community land trust. So I'm a farm worker kid. I'm married to another farm worker kid, and with yet another farm worker kid, right, from a different family, the sisters from another mother, we call ourselves, right? We bought a duplex together, and that's how our families together were able to make a life that felt more sustainable for us in Sonoma County than remaining renters for the generations before us that also were renting. And so, just in that idea, it's this, it's kind of taking a plunge into a structure that is definitely not traditional. And that can scare folks thinking about, like, I'm going to buy a house with a friend. Like, do I want to do that? And, and I just want to share that, that is very much connected to this idea that, coming together and bringing our assets together, we're able to do much more. So I love that idea. I know that NBOP has a fantastic person, Belen Lopez Grady, who is working on organizing community land trusts throughout Sonoma County. She's fabulous to talk to. I hope everybody gets a chance to pick her brain and talk to her about the wonderful folks that she's organizing, to really think about how to get a model like this off the ground at a larger scale than just, our little Franklin Ave duplex in Santa Rosa. So, sí se puede. And I think that is the philosophy that's going to be able to move the needle in some of these really challenging areas for all of us and for our community as a whole.
Go ahead.
Excuse me, just a couple of quick thoughts. I really wanted to echo what Jason was saying about high touch models of community development. I think this kind of goes in line with this idea around community trust as well, because community trusts are often used as a way to maintain housing affordability. And one of the challenges that we see when development does come to low income communities is that sometimes people are pushed out because sometimes development means increased costs of housing. It means, properties that were dilapidated are being bought up and flipped. And so I think when we talk about community investment, it's important to keep an eye on the importance of maintaining housing affordability and how that's done. Community land trust being a really great model, and I think probably one that has not really hit, hasn't been scaled up, I should say, in the affordable housing world. But also along those lines, I think there's conversations about how do we make housing more affordable, different housing models, including smaller housing units and, shared housing models and things of that sort. And then the other thing that I wanted to mention as well, along the lines of conversations that we're having, the conversation around homelessness and subsidized housing is, where are we building housing for individuals? Where are we building affordable housing? If someone has a Section 8 unit, where can they find housing that their Section 8 voucher can pay for? So in my work around homelessness, one of the things that we've seen that's been really challenging is that once folks obtain their voucher, they spend up to 6 months looking for a housing unit because there are no housing units available. And they often, the only place where they're able to find a housing unit is in low income communities that may have other challenges. And so maybe, you have someone who's been chronically homeless. They have various things that they might be struggling with, maybe addiction, maybe mental health, physical health, disability. And they find themselves in a place where the only option that they might have for housing is somewhere that they're not familiar with, somewhere they may not feel safe, somewhere where they do not have access to quality food. So, I think housing affordability and where housing is located is just such a key issue when we talk about health outcomes.
Thank you, Melissa. And so, Chris, did you want to add to that?
I just had a thought, in Petaluma Ecumenical Property stands out to me as a way where they've infilled in places sort of all around and sort of breaks up that tendency towards segregation of housing. And I think that's what Santa Rosa needs more than anything is some of these community, infill in some of these great, that could be good communities with more, a broader array of folks there that would, where they could build affordable housing. Like in Bennett Valley, there could be affordable housing, but then there's the not in my backyard issue, which is really hard. But there's also maybe the land trust infill in places where you could maybe do that and build in some of those places. And then people could have, housing all over the city rather than I worry a little bit. I mean, Sam Jones is better than nothing, but it's not really ideal for folks. Obviously, it's just a shelter. And Caritas is really attractive and potentially great, but again, it's going to be in one giant location rather than finding that housing around the whole city. So I guess the question part was going to be to Dennis around what do you know about Petaluma Ecumenical Properties and how is it that they worked to find these places to get to create housing within neighborhoods all over?
Dennis?
Yeah, I agree with you that they've been a certainly a positive influence on our community in this way. They've mostly dealt with seniors, not families. I believe their project that's just getting started now, the latest project, has some space for veterans, but I imagine those will be more likely seniors as well as time passes. I guess I still wrestle with the idea of offering more housing options in closer space to each other. I like the inclusionary ordinance that we have now, where 15% of all market rate developments have to be affordable units. Although I'm not sure, that's always appreciated by people either. And I don't mean just people at the top end. I mean people, in the affordable units as well. I've seen some criticisms of that as well. So I think it's very difficult, but certainly I believe, one of my campaign statements I said more times than I can count is that everyone who lives here everyone who works here should be able to live here. And that should be true everywhere. And so the rest of us may just have to pay more for our meals out, or whatever, as we try to reach equity in our community.
Melissa?
Yeah, as Dennis was speaking, a couple of things that came to mind with regards to affordable housing development. So I think, a couple of key questions are, we talk about affordable housing development, but that's just a wide spectrum as well. And what we oftentimes see is that the lowest income households actually do not qualify for affordable housing, and it's going to higher income households. So I think that's one thing to keep in mind. I'm not an affordable housing developer, but I do know affordable housing developers. And I know that one of the greatest challenges is finding land to build on, and also dealing with not in my backyard, because there are mechanisms that can completely stop an affordable housing development from going forward, that communities can use in order to, that really puts a pause and actually increases the cost of affordable housing, because affordable housing developers might have to go through court and litigation, extends the life of the project. So I think there, in California, we've talked about the role of the California Environmental Quality Act, CEQA. I think I'm remembering the acronym correctly, and the role that plays in stopping development and how it affects affordable housing development. One of the pushes that we've seen locally in Los Angeles is to make an exemption for affordable housing units to not have to go through CEQA. So, there's different avenues that we can pursue to make the construction of affordable housing a little bit more accessible. But yeah, I think getting community buy-in is a huge part of that. And then the other thing that I wanted to say with regards to the inclusionary zoning and mixed income housing, there's a lot of work that's been done on mixed income housing as a promising model. And there are challenges with that. And one of the early learnings from some of the work around Hope 6 and the redevelopment of public housing was that you don't want to have affordable housing units that look different from market rate units. So that was an early learning where, we saw developers were building separate units that were affordable, and then you had the market rate, and that created a lot of issues. So I think also how we approach inclusionary zoning and how we're building and designing these units, how we're also creating community within the apartment complexes are really important to consider.
Yeah, thank you, Melissa. Jason?
Yeah, just a really interesting conversation about necessity of a portfolio of housing opportunities and looking at chronic homelessness and also housing insecurity and housing opportunities. We think of, just over the COVID experience, like Chris was talking about, even the Guerneville Navigation Center in our rural Guerneville area, just having a 10 by 10 square where you can put a tent, how much we've seen a reduction in drug use and mental health disparity, just because they have that basic safety. And then buying space for RVs, buying space for cars to be parked in a way that's safe, all the way up to, we have a wonderful advocate on our board, Deborah Johnson out in Guerneville, who purchased a river resort of 13 small units. And she's housed people directly off of homelessness they're amazing. They're doing an incredible job. And so working with realtors and landowners and figuring out creative ways for us to get a portfolio of solutions that allows us to move forward. And so not just looking at individual solutions, but looking at a portfolio, I think is a really creative, interesting future for us.
Thanks, everyone. I want to pose one last question, and I promised everyone that we'd also get a chance to do some audience Q&A. So want to encourage everyone who's listening right now to also go ahead and drop any questions there. We'll turn to audience Q&A in just a moment, but wanted to also ask about COVID-19 and housing, just segueing from what Jason was just mentioning as well. And I want to start with Alegría and asking about one item that came up during our conversation earlier was around the increase in H-2A migrant farm workers living in bunk housing, and how they're isolated and often disconnected from the larger community, the larger network of services. In a COVID-19 setting, the risk is much higher. And I don't think we've talked very much as a community about as some of these folks. I'm curious kind of what your experience has been and what you're seeing on that front.
Sure. So when I was practicing law, I represented a number of H-2A workers throughout the state, and really have a firsthand understanding of the challenges of what it means to be deeply isolated and completely reliant on your employer for your housing, your food, your paycheck, a ride to the store, and the level of, whether it's intentional or unintentional, but the high level of kind of housing and labor abuses that result from that kind of very focused and very specific connection between your housing, your food, and your employer. And then those visas are also limited to just that one employer. So if you have a challenge as a worker, and this is particularly important for women farm workers who may experience sexual harassment at work, your time in this country and your ability to stay in this country is limited to your work with just that one employer. And so it really locks people into a situation that could be very damaging. Bunkhouses in Sonoma, given our rural nature, while there is kind of stable housing that's provided, they're really also invisible. They're kind of off the beaten track. Folks who come in to work in the fields in that situation, typically come the transport from their home countries to the place of their employment and housing is provided completely by the employer. And so I litigated cases where, people were driven up in the middle of the night from a border town in Mexico to show up in a bunkhouse some 22 hours later, not having any idea where they were, and given documentation in a language that wasn't their own. And so when you think about kind of the context that is laid, or that foundation that's laid for folks to then come into the county of Sonoma, and to understand how to connect with resources and how to be part of this community, it's really challenging. I think the other thing that we should acknowledge is that given our immigration challenges in this country as a whole, the reliance on H-2A workers by the ag industry has actually increased as a result of labor shortages. And so, it's a devil's choice for a lot of folks in our community. And I acknowledge, the difficult situation that many ag employers find themselves in to secure regular employment in the work that they need to get done. But I really want us to be able to kind of shine light on those spaces throughout our community and recognize the intense need for us as service providers to really kind of pull those folks into the ways in which we understand our larger population to be served, as well as to recognize the kind of inherent housing challenges that may exist, as well as health challenges for folks in those very, very isolated situations. And so, in many ways, difficult farm worker living conditions are designed to be invisible. And my challenge to all of us is to be able to use our lenses to make sure that we're seeing those places that were designed to be invisible, right? And to make sure that we're capturing those challenges in the way that we understand our housing challenges in our community as a whole, and to understand that there may be some benefits to the idea of employer provided housing, without that level of reliance and isolation from just that kind of employer-employee relationship that can make things really difficult in lots of situations. So I hope it's something that as we talk about housing challenges and communities that can go under the radar, that we're really kind of opening our eyes to this population, which is now thousands of people in our community during the height of certain work, certain seasons in our county, and really kind of understanding that those folks are also part of the communities that we serve and whose housing we should be concerned with.
Yeah, thank you, Alegría. That's when you shared that earlier, that wanted to make sure that we got a chance to lift that up as well in this discussion, and I want to turn to everyone and see sort of maybe broaden the question a little bit as well, in terms of the role that you're seeing housing play during this pandemic as well, and how that's showing up in your work.
Sure. So one of the things that the Department of Health Services has done is pull together a Latinx health work group that is really grounded in kind of the experiences and the knowledge and the expertise that exists in our community service providers. And you know, we chose people who weren't just health focused in the same way that you chose this panel to be kind of broader and hopefully unsiloed as we engage in a much richer conversation as a result of having people that are not just health focused or not just housing focused, right? People's bodies are not divided by, you know, our departments or our jurisdictions, right? And so I think the challenge for all of us is to figure out how we, again, see people as holistic and not like, you know, this person lives in District 2, but they work in District 5 and their home healthcare is in District 3. And so, you know, how do those divisions actually help us as a community as a whole to understand, you know, the kind of holistic needs that individual brings to all of us together. You know, similarly, I think so much of what Oscar is doing and what the Office of Equity is doing together with other departments is to erase those silos and to start, you know, recognizing that the cracks that we create by being siloed are exactly those same cracks in which the most vulnerable people in our community fall. And so how do we kind of close those gaps as providers to make sure that we are not creating the structures that create vulnerability, right? And then calling people vulnerable, well, we made them vulnerable, right? By creating those structures that divide them up and divide our services up in that way. So thanks for that question, Jesus.
Well, if I want to just give folks a last chance, if any other comments on that before we transit, we do have some audience questions, and again, want to encourage folks to drop those in the Q&A chat. But Jason, do you want to add there?
I mean, if specifically to COVID, I think it's worth saying that housing definitely affects the transmission rate. So those with congregated housing, small units, not able to live in isolated areas during quarantine, not able to get. I'm really thankful for the work the Kura project and the financial support the county's putting out for people to be able to be financially sustained while they're quarantining. Otherwise, people are in multiple person housing and then they're spreading it to work. The good example, the non-congregate setting or shelter out in Alliance has really made a difference to be able to get people off the streets if they're vulnerable. The non-congregate shelters, the Greenville Navigation Center, the Finley Center, all those things have made a difference in reducing spread. And it's hard to quantify that, but I think housing and COVID is an incredibly integral discussion. So.
And Jason, before we go to Melissa, I'd be remiss if I didn't also invite you to maybe share a little bit about the recent launch of Little Actions, Big Results. I don't know if it's too early to share about that, but if you're at liberty to do so, that'd be great.
Yeah, only to say that it's a hope to be able to bring together resources and community. So this is really a goal of collective action. I think to be clear that we as a community have a history of collective action and doing things together, and we have become more siloed. And it's important for us to, particularly in the pandemic, to be able to decide to work together. So this is a behavior change campaign for Little Actions, Big Results. Alegría has invested in that for even changing the name so that it's not just about, we used to be called It's About Us, and now it's called Little Actions, Big Results. It's about little actions for me as an individual, little actions for me as a father, as a leader, as a business, as a place of worship that we can do. And it's designed to also provide resources, so connections to important resources. So we're hoping to allow this to be a place where we can come together and share that vision together. It's also joint funded. It's independent, so it's less tied to structure.
Thank you. And I just dropped the website for folks to check out as well. But I want to turn back to Melissa, who wanted to also add, and then we'll turn to audience Q&A.
Thank you. I was just going to add a comment to what Jason was saying. So, I think the spread of COVID-19 in congregate settings, homeless services, specifically within shelters, has been a great concern. In addition, I would add that crowded housing and having folks doubled up has also increased spread. So we've seen disproportionate rates of infection of COVID-19 among the Latino community, which if we look at some of the research that's been done is more likely to live in overcrowded housing and to be doubled up. So, you know, that obviously raises concerns for the community. I think it also raises greater questions around how we define housing instability and how we also think about resource allocation. So, you know, one of the challenges when we talk about Latino homelessness is that, you know, when we look at the numbers that are found in homeless counts, for instance, we actually see that Latinos are slightly underrepresented than one would expect given poverty rates. In part, past research has suggested that this has been because folks are more likely to double up and to rely on social supports. However, now with COVID-19, we're seeing that one, not only is this a situation that's creating increased spread and transmission among this population, but two, given the economic consequences of COVID-19, there are also folks that have been on the cusp of homelessness for a long time that are easily falling into homelessness. So, you know, I think just wanting to push folks to think a little bit more about how we're thinking about homelessness, the definitions in terms of resource supports.
Wonderful points. Thank you, Melissa. And it looks like we're running short on time, but I want to make sure we get a couple of the comments in from the Q&A. The first one was regarding the Housing Land Trust of Sonoma County. It looks like it's working, it's a comment, it looks like working hard as our local community land trust. And the commenter says, we love to partner with cities, employers, and developers to create more community land trust properties. Perpetually affordable housing is a wonderful, economically efficient solution. So Kathleen, thank you for dropping that comment in there as well. Teddy commented, fully support that perspective, Jason. So some great comments here. First question that we have, how do housing shortages affect your ability to deliver quality healthcare to communities? From Stephanie. So any takers on that question? Dennis?
Well, I mean, the easiest one is that if someone doesn't have permanent housing, it's hard to contact them and follow up. They may not have a phone either. They may be in a different place when you wanted to call them in 3 days than they are today. But I think beyond that, there are other issues as well. It's hard for them to find the time and the let's stay on time a while, because you know, it's a big issue with poverty and lack of housing. How is this person going to find the time to do anything, even to get to a drugstore and fill their medication, as opposed to doing several exercises that they get prescribed by a physical therapist. It's very difficult to just do the everyday. These little daily hassles become major events that cost people their jobs and their physician visits, their follow-up visits. I guess that's where I come from.
Thank you, Dennis. Chris?
Yeah, so you know, we at Brookwood, I don't know if anybody's familiar with the Brookwood Clinic, but we are the Homeless and Special Populations Clinic in Santa Rosa, part of Santa Rosa Community Health. And we are a boots on the ground, a bunch of people there really striving to create a system of care that meets people where they're at. And it really requires a level of interdisciplinary work that we are gradually building up. We're working with the county. We've worked really closely with the county and the boots on the ground workers like Alan Powell, who helped mitigate the syphilis outbreak a couple of years ago. We worked very closely with him to help meet people where they were at. We have a nurse, Natalie, who has tremendous homeless experience, and she goes out and we find people and we figure out how to help them get the care where they are. We're trying to take our show on the road with our small little van, and we go to Sam Jones, and we're going to go to the day services center, and we go out to Los Guilicos, because if we meet people where they're at, they're more likely to be engaged, and they're less likely, if we don't go out there, to get to Brookwood, and we know that. So we're not trying to get them to come to Brookwood unless they want to. If they can, great, but we're gonna go find them. And I think systems of care have to evolve to meet folks where they're at.
Thank you, Chris. And we'll just want to offer one last question here from the audience because we are at time at 7 o'clock. So I want to make sure that we honor folks' again time here. And we have Jen Close who will be joining us here just to say a few last words to close up the evening. But we do have a question from Fred who was asking about how we can get some folks to come to Sonoma Valley and rattle a few cages to highlight the issues that advocates that we're talking about tonight. And maybe even doing an equity roadshow focus on the Springs and Sonoma disparities. So I don't know if anybody wants to take that question. I see some thumbs up, so it looks like that's a yes.
Makes it a lot easier on Zoom. Yeah.
Good. Well, great. Well, we'll close up with that then. Thank you everyone for being with us. I want to invite Jen Close, who I'm going to bring on here. Bear with me for just a moment, and she'll have a couple of words to share with us here. Hi, Jen, can you hear us?
Am I here? I can hear you. I don't see myself, so I don't know if I'm... Oh, there we go. Oh, technology. Hi, everybody. Sorry about that delay. Thank you so much, everybody, for being here. This was an amazing panel. And, the silos that you talked about, we got to break through these silos in order to deal with these significant challenges and get to some solutions. So this is part of how we do that, are these kind of conversations. And, the connection between housing and health is obvious. 8 years difference in life expectancy across zip codes, couple miles apart, or this great increase in risk of infectious disease right now, COVID, with overcrowding that we're seeing. Oscar was right when he said it's absolutely unacceptable. And our team here at Generation Housing, we're working hard to advocate for more housing, for more kinds of housing, for more affordable housing. And everybody here who has joined us, thank you for being here. We need you to help us do that. We need to be able to show up at city councils and at supervisors meetings and at state commissions and say, we are Gen H and we represent 1,000 or thousands of members. And that we are Gen H and we love Sonoma County. We want to stay here. We want our kids and our grandkids and our teachers and our firefighters and our farm workers and our baristas to be able to stay here and not just make rent, but really thrive here. So all of you who are watching, if you haven't joined us yet, please join us. You can join us for as little as $5 or for $50, you can get a t-shirt like Jesus and I are modeling tonight. And tonight also, if you use the code EQUITY, you will get a free book. We will send you this free book, The Color of Law, Richard Rothstein, A Forgotten History of How Our Government Segregated America, all about redlining laws. It's a fascinating, important read. So we'll send you one of these if you join with the code of equity. Thanks again to our panelists and for everyone for being interested in this and listening and paying attention.
Great. Thank you, Jen, and thanks everyone for joining us. And with that, we'll let everyone enjoy the rest of your evening. And thank you all for being with us.
Thanks so much.
Thanks, everyone. Good to see you, Jason.
Good to see you, Chris.
Thanks.
Take care. Bye, everyone.
Bye-bye.